Good morning. I'm going to get my hands washed here. Okay, before I enter in the room, I'm going to verify my patient's name and date of birth. I have Phyllis Lampin Vance, 2/15/1962. She does have allergies to penicillin, iodine, and morphine. I'll confirm that with her when I go in the room. Okay, and looks like orders today are to place an IV for the patient for Dr. Gray. All right, so I'm getting some gloves on here. All right, I think we're ready to go. Okay, so then I got my supplies. I have my needle, my catheter, 20 gauge catheter. I'm ready to go with that. Okay. I have my epidural. My band. I've got a 10 in my syringe. And I have my IV extension line. Okay, so let's go ahead and go in to the room. Knock, knock, knock. Good morning, Phyllis. My name is Anna. I'm going to be your nurse today. Can you remind me your name and date of birth, please? Great. All right, and I have that 2/15/62. And your allergies are penicillin, iodine, and morphine. Thank you very much. I'm going to get this bed up to a height where I can work a little bit better. So Phyllis, it looks like Dr. Gray has ordered us to place a peripheral IV today. And it looks like I'm going to use your right arm here. Do you have any questions? Okay, great. I'm going to walk you through it as we go. Okay, so I'm going to wash my hands and get some gloves on here. Okay, so I have my Tegaderm, I have my IV extension, I have my needle, I have my all right, and I have my, okay, so the first thing I'm going to do here is I'm going to put this on here. All right, and try to palpate your vein. Oh, you have good veins, Phyllis. That's awesome. Okay. Very good. All right. Then I'm going to go ahead and clean the site for 30 seconds. Okay, great. I'm going to let that dry now. Okay, wash my hands again. I'm going to put on some clean gloves. I'm going to get my supplies ready to go here while that's drying. Okay, so I'm going to take a look at my needle. The needle is good. That, make sure this moves appropriately. Good. It's good to go. Get my IV extension set out. Go ahead and scrub the hub on that for 15 seconds. All right, that's nice and clean. Perfect. Then I'm going to go ahead and prime my 10 ml syringe. That on here. Great. I'm going to pull back, and then I'm going to do it over the garbage here and get that all primed up so we're all good to go. Okay, and go ahead and set that down. Okay, so now I'm going to go ahead and put the tourniquet back on. Okay, and I'm going to grab my needle. Okay, bevel up. Okay, Phyllis, this is going to be kind of a big poke. I'm going to anchor it down below. Okay, and 1, 2, 3, big poke. Good job. And I have return. I'm going to go ahead and advance that. Wonderful. Then we just hold that down here. Okay, I'm going to get my Tegaderm out and anchor this. Here we go. All right. Okay, that looks good there. I'm going to go ahead and anchor this, pull the needle out, attach my fluid. All right, I'm going to pull back. Okay, I've got blood return. I'm going to go ahead and flush the line. All right, wonderful. Now I'm going to take my tape here. I'm going to tape this down. A little bit on this side. All right, that looks good. All right, I'm going to take my gloves off now. And I'm going to get my date, time. And 8:40. Okay. I've got my label. Okay, put my label for my fine work here. Okay, and clean up my mess. Okay. All right, Phyllis, I'm all done with you here. We'll get you back into a lower position. Are you feeling okay? Okay, great. I'm going to go in and document in the LDA that I place this in your right lower forearm. Okay. If you have any questions or need anything, let me know.